welcome to our virtual open house of our Medical Assisting Technologies program. I'm here with Marisa Maidment, one of our medical assisting instructors. She is our go-to gal for administrative medical assisting. Hi.
Hi.
So will you tell us a little bit about you and your experiences and why you're here?
Okay. I was a medical assistant for 10 years in the medical field, and then I decided to teach. And I have been teaching for almost 6 years now. I came to Madison last year and I love it here. The support staff is awesome. They helped me to become a better instructor. What I mainly teach is the administrative side of medical assisting, and that is like a lot of the paperwork. The girls find it kind of boring, but then they get interested in it. I'm helping out now the clinical side that Marie usually teaches. She's our clinical professor, and I'm just helping her out. So today we're doing clinical.
So you mentioned that you teach the administrative side, which is a lot of the paperwork like electronic records and coding and billing, those kinds of things. And then there's the the clinical side. So what kinds of things are they learning here?
They learn vital signs, which are blood pressures, temperatures. They learn how to take patients back to the room. They assist with procedures in the medical office that the doctors have. They can actually, as far as jobs, they can go into specialty, urologist, any kind of specialty doctor they can go to. They can go to DOs, MDs. From here, they get their STNA, they get their RMA, and they also get their RPT.
Yeah,
okay, so they get 3 different degrees here. They do phlebotomy after this MAT portion.
So that's what's pretty neat about this program. It combines some of the basic skills of STNA that you have to be a medical assistant anyway, and we add on those phlebotomy skills, so you get certified in all 3 areas, not just one overall medical assistant. So you have lots of versatility when it comes to jobs. What kinds of jobs have your students that you've had in the past, where are they working now?
Okay, I have students at urgent cares. They're allowed to go into them, and they're all over, so it's easy to get into the urgent cares now. They also are working, I have a girl at eye specialty, she went there. Kidney specialist, she can go there, they can go there. So it's wide open now for medical assisting. And they also later can become office managers if they want.
Yeah, that's pretty neat. Anything else you want to share about the program?
It's just a wonderful place. We become family and friends here. Once you go through the program, you're not forgotten. We reach out to you continually, make sure you have jobs and how it's going if you do get a job, and we bring you back and let you talk to the new students and tell them what your experiences were in open house and orientation.
So this program, it's offered both day and night. So we have a daytime class and an evening class, so we can fit most people's schedules. It's about, depending on daytime or nighttime, 9 months to 13 or 14 months, because the evening class is a little bit longer, and there's financial aid available and some scholarships we can refer you for, so we can make it pretty easy to manage. Thanks.